could get everyone to rise for the invocation and the pledges, we will get this meeting started. And Commissioner Modis is going to lead us in the invocation.
Dear God, we thank you for the blessings of healing. Your love and your ministry have taught that healing has gone on through the ages. And we thank you for being blessed to have a community with such an abundance of healers, of people who, through their faith, through their blood, their DNA, Lord, that they heal us and they provide us comfort and they provide us guidance to help live better and healthier lives and to repair us when we're broken. That is something valuable that cannot be replaced, and that is something that is essential for all communities to be vibrant. We thank you today for this opportunity just to begin discussions on a very important topic. We pray for discernment today, pray for the ability to listen to all the sides and to be able to advocate for those in need, and especially for all our doctors and medical staff who are here, living here in Oasis County now. Thank you for your blessings in your holy name. Amen.
Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible. Thank you. You may be seated. It is 3:12. I am certifying we have a quorum present. All members are here. We are at 901 Leopard at the Nueces County Courthouse. We'll move right on into our agenda for next up is really public comment, but I'm going to do something very different. I would like to ask if there's anyone here, since we did post this meeting, that wishes to speak on anything other than the agenda item listed. If we have none, then we're going to come back. Don't worry, you're going to get your opportunity to speak, but we're going to do things a little bit differently. We have a couple of presenters, and then I will go through the individuals who have signed up to comment. We are going to start with SPAWN since they initiated this, and thank you, Don Dominguez, for being here. We will give you as much as you need for your time, and then we will hear the other side as well. Oh, let me be clear too, sorry, there's like a 10-minute limit for you, a 10-minute for you. All of us we have somewhere that we have to be by 5:30, so this court is going to end. We need to get through with this. This is a work in progress. We're not meaning to cut anyone off or stop anything, but we want to hear everything. We also have some ideas about setting up a working group with some different selective members that I would like to form a committee to maybe address this and talk more about it in depth and stuff if we have willing participants. But that is my plan for this moving forward. So thank you. I'll give you the floor.
Thank you, Judge.
Yes.
Thank you, Commissioners. Commissioner Chesney, Commissioner Jag, Commissioner Modis, Commissioner Hernandez, thank you for the forum. I sent a letter, Judge, per our conversation to you in the Commissioner's Court. I'd like to read it. I'm writing to you about the recent decision to phase out the emergency medicine residency program at Christus Health System by June 2026. There's been a lot of speculation, questions, misinformation about the decision to end the program, which is the partnership in conjunction with Texas A&M. I want to assure you, the residents and the faculty, our associates, and our community that the decision to phase out the program was made with thorough consideration of our community's needs and the ministry's available resources to serve those needs. We ultimately determined that the ability to sustain this program would end with a graduating cohort in 2026. To ensure the quality of care of our patients received will not change, we are committed to seeing the emergency department staffing and other health services remain strong as we wind down the teaching program. Our family medicine residency, as well as our family medicine obstetrics and geriatric fellowship programs, will continue unchanged. We also have invested separately in a nurse residency program to support new graduate nurses as they develop skills to practice independently, in complex areas. We are also committed to the residents currently enrolled in the emergency medicine residency program. That's precisely why, as we have communicated to them, the program's date of closure isn't until June 2026. For any impacted associates, we will do all that we can to provide support, including but not limited to assisting them in finding another open position within Christus. I want to stress that as we end the program, it will not impact patient care at all. Our emergency department will remain intact at all Christus Spawn hospitals, both in Corpus Christi as well as in our rural communities like Clayburgh, Alice, and Beeville. The emergency medical program has been around since 2007. When it was created, we were only one of 3 emergency medicine residencies in the state. Now there are 18. The program has been staffed far and above the graduate medical education GME cap, and it is privately funded by Christus Health for many years as a result. We are proud of the more than 120 graduates that have supported and our current residents here supporting today. The American College of Emergency Physicians sponsored a workforce study in December 2021 and found that there will be a surplus of emergency physicians by 2030. Furthermore, in 2023, 555 emergency medicine slots across the United States went unfilled. The number is up from 2022, when 219 were unfulfilled. Simply put, there is a national oversupply of emergency residency slots. Again, this is not an easy decision. Ultimately, we are simply unable to sustain the program for the long-term future. The majority of this program has been privately funded throughout the years by Christus Health. As a nonprofit health system, Christus Spawn remains dedicated to quality and affordable health care. We serve as the Coastal Bend. We will continue to focus on making integrated and consumer-focused care accessible, reliable, and personal for all the people we are blessed to serve as we extend the healing ministry of Jesus Christ. Thank you.
Thank you.
Judge,
Hi.
I would like to elaborate a bit, and then
Yes.
whatever form that you wish to, sir. Wham. Number one is, I'm from this community, Rockport, born and raised here. This is where my parents come. My parents came to the hospital at Memorial. That's where my niece passed away. My dad received great care from some of these doctors right here in this setting. Some of the toughest decisions ever made. Spawn has a commitment to this part of the world of South Texas. Its commitment is fully to the community that we serve. That includes ER. That includes family medicine, internal medicine, cardiology, surgery, spine, orthopedic, and the very difficult specialties to find like neurology, gastroenterology, neurosurgery. Those are commitments from Spawn. Like any organization, there are scarcity resources. The data we reviewed is what I mentioned in there. That the decision to wind this down is not easy. As we said in private meetings with both the faculty, and it was brought up, and the residents, this faculty took care of my parents and do. As you look at the relationship with Spawn, it is a relationship with the hospital district that's special. It's unique, and we consider it a partnership. We're proud of it. We attend to it. It's what you deserve. The commitments to the west side of town and to those that are in the margins, Spawn's mission has always been a part of, dating back to 1905 when the sisters came to Corpus Christi. That has expanded, and we're blessed to employ 3,000 associates in our community. Actually, there's 3,300 individuals that work at Spawn, but it makes it full-time 3,000 individuals. That's a payroll each year of $285 million that the community deserves. The commitment's there. For the past 6 to 7 years, with donors and Spawn, Christus Spawn, we have provided in excess approaching $500 million in infrastructure in our community. That includes a renovated, rebuilt Spawn shoreline. That includes a massive addition to Spawn South. That includes the addition of the Christus Surgical Hospital, previously South Texas Surgical Hospital. That includes growing, and I'll speak to that, primary care in our community. There's several ways to move healthcare closer to patients, healthcare closer to your community. But not only Nueces County, San Patricio County, Duval County, Aransas County. We can go down that list. B County. One way is to put up freestanding EDs and place them up in the community, to staff them for your staff or your employees for the communities to attend to. and get good care, really good care. Or another way is to put primary care and specialty care in clinics closer. We chose the second, for at least a couple of reasons. It sets up a responsibility and a co-responsibility with patients. Your prayer, Commissioner Mottis, of learning and assuming responsibility for our health care. It sets up those, and we're in dire need of that. We started with 3 years ago, 26 primary care providers that are a part of the Christus Trinity Clinic, Thomas Spann. Well, prior to Thomas Spann, we're now at 63 primary care providers. I'll define that as nurse practitioners, internal medicine, and family practice. Commissioners, Judge, we need about 162 of those. Right now, if you go to Portland for our clinic, it might take you 90 days to get in. Over on the island, where we have the only clinic that's through a health system, it'll take you 30 to 40 days. We don't need 3 providers on the island. We need 6. We need 6 providers at least in Calallen. We need another 10 or 15 over on the south side of town by Spawn South. We need 6 providers at least in Portland. We need providers in Rockport, Mathis, Sinton. We need more care with collaboration in the Oasis County Hospital District for the underserved areas, particularly the west side and Robstown. Are we utilizing technology? Are we utilizing our settings? Are we utilizing extenders? Are we utilizing our bus system to make sure we're caring for those? Spawn is blessed to serve the poor. That has been our mission since the founding of those before me. Spawn is fully committed to this part of the coastal bend, to the coastal bend, to this part of Texas. The needs of this community are there. They are around internal medicine, family medicine. They are around neurology. We have a real deficit. They are around gastroenterology. We'll have a real deficit. They are around electrophysiology when it comes to cardiology, with doctors coming in from out of town. We'll continue those commitments to grow those. To get back to our relationship with the hospital district is one that we're proud of, and it is a partnership. That'll continue, and it'll grow. It'll grow with that collaboration of the team. It'll grow in the areas that the community needs, and it'll utilize technology. This is a very different environment than it was in 1997 when this agreement began. It's more important, I believe, than ever, given where we are in healthcare, given the cost. The cost of seeing a patient, the cost of seeing a doctor in a primary care clinic pales in comparison to the cost to the residents, to employers of going to an ER. We have made the commitments in the ER setting, for the best care around. There are 4 large ERs in town, 2 by Spawn, 2 by HCA, 1 has a residency program. We will go back to a setting that has ER doctors, board ER doctors, the right complement of them, the right setting for that to be received. We'll focus our time and our resources on what I spoke of just now. I realize this has been the hardest decision of my career. It is, bar none. This is where my family receives care. I'm committed, Judge, Commissioners, as we spoke of, you mentioned a group coming together. I'm committed to begin that with a meeting with, we met this morning. Commissioner Chesney, thank you. Commissioner Mottis, thank you. It was open, it was deliberate, it was professional. Spoke to the needs of the community, so did I. I believe it's probably your call, Judge, but include a member of the Oasis County Hospital District, whatever you might think. There has been information posted on social media that attacks me personally. I think that comes with the job. I don't think it has to, but it does. Okay. That has not been posted by Spawn. And I realized earlier, just a bit ago, that a private conversation with the faculty and the residents was recorded. And now the press has it. Okay. There's nothing in that meeting that I'm concerned about. Nothing. But I am concerned that next meeting I have to go to, we have to take out our phones because we can't trust each other. We've got to put everything aside. The meeting today was not recorded with Commissioner Mottis, Commissioner Chesney, because it was a meeting to get to some resolutions and some problem solving that involved this. But also, I would have to say, it should involve other specialties that are just so desperately needed. And then all environments have a scarcity of resources. The studies I just noted are from the American College of Emergency Physicians. It's not from SPAWN. The program was needed in 2007, and there were 3 residency programs, 18 now. Those resources are needed in other areas. We'll continue to resource every department, the ER, radiology, anesthesia, pathology, and we'll continue to recruit into the community the specialties that are needed that I mentioned, and others. That is a commitment from SPAWN. We'll continue to provide capital that no other company will match in this area for healthcare. None. We'll continue to recruit into town those physicians that are here full-time. I thank you for the time. I thank you for the time, Commissioners.
Thank you. And I appreciate your willingness to serve on this committee and lead this committee. And I would ask all members that we ask to serve on this in the future in order to move forward with solutions, that there is no secret recordings. This is a working committee to
Judge,
come
I'm
to
willing to meet
solutions.
with Commissioners. I want to clarify.
Oh,
And a hospital district member. I'm not saying that can't evolve into something else right now. That is who I'm willing to meet with, Judge.
I would ask you to reconsider and at least have a community advocate. Karen Urban has offered to serve on this, and at least a doctor from their side. We can't really hear issues or find problems or see where we could maybe meet in the middle if we don't allow both sides. And I would ask you to seriously reconsider, and I hope that you would. And I would ask anyone who steps up to do this in good faith. This is for our community. This is not about getting on the news or getting a gotcha moment or recording someone without their knowledge or finding something to move forward. This is about finding solutions for our community and moving forward in the best interest of our citizens.
I was not aware of that it was being recorded.
Yes.
There's nothing, as I said, and I'll reinforce
Yes.
that I'm ashamed
Yes.
of, but there is a part of that I, right now, I will, at your request, reconsider.
Thank you.
I can't give you that answer right now, but I will, Judge.
Judge, I just want to clarify on that then, since
Public comment or what?
I would just like to, I'm not public, I'm just
No,
responding.
no,
He did a presentation. This is fine. We can talk. This is all about this. He was scheduled to speak. No. Public comment is no talking. Yes, no, he did a presentation. And we're
sorry,
going to
I
allow
thought I-
one doctor to do the same, and then we will do public comment. Yes.
So, yeah, I definitely want to hear the presentations, but I am disappointed. We had this conversation outside. All the progress that was made this morning, you're kind of throwing out the window if you don't reconsider, because you gave Commissioner Modas and me your word that you would do this. I understand that something happened between when we met that you just dictated or just talked about, where someone sent some recording of some meeting that I don't know anything about, and quite honestly, it's not my business. But what you're doing, so that we're clear, if you don't want to meet in this group, that's up to you, but you're then going back on your word to me and Commissioner Modas that you would have that conversation, because I get that you're uptight about that and you have a lack of trust, but if you don't think all these people in the room have a lack of trust with you, then you're miscalculating. But they're still willing to sit in a room with you, even though they don't have much trust in you right now. So I would ask very strongly that you consider, based on the fact that you did give Commissioner Modas and myself your word, that you would have that meeting. And let me tell you, feelings are hurt. You and I had a great conversation today. My feelings were hurt big time because I got blindsided by this like everybody else did. Hospital district board members that I talked to got blindsided. SPAWN advisory board members that I talked to got blindsided. So if you don't think my feelings were hurt, as you saw it this morning, but we got through it. We worked through it. We came up with what I thought was a reasonable plan. You didn't commit to anything. I didn't commit to anything. You committed to your position, I committed to mine, that I think your decision is wrong. You think that I'm wrong in my decision, but we committed to sit down and have, as I called them, the peace talks.
Yes, sir.
Before we go to war. And now, if you're backing out of the peace talks, that puts me in a really bad spot, because there's no point in going and having a meeting if they're not involved and included in this, because I can't speak for them. The hospital district can't speak for them. You can't speak for them. The judge, we can't, if they're not in the room, then there's no point in even having that meeting, and we might as well just go on down the road and see how it falls. And I'm just saying that as honestly as I can, because I'm super disappointed that.
I was too, sir.
Within 3 hours, yeah, but what happened to you didn't happen to you because I did it, or Commissioner Modas did it.
No.
You gave your word to us. So if you need to cool down about it, I get it. I mean, we've all been uptight about this, so I'm truly asking you to reconsider this and come into it, because I really felt good coming to that meeting that we were gonna go in with open minds and open hearts and really try to see. And we talked about how maybe the community needs to step up, maybe the hospital needs to do more. Maybe we talked about a lot of what ifs, but if we can't get in the room with the people that make the difference, then I don't know what to do, because I don't have the expertise that these doctors have to be able to talk. I got their information, but I can't talk it like they can. I don't live it. I don't breathe it. I'm trying to advocate for them in the best way I know how to, but so please reconsider that decision, because this was, I've not seen something handled like this in a long time, and I'm trying to get it back on track and forget all the egos and forget all the personalities and forget all the emotion, and let's just see if we can help this community, because, and I'm asking you to do the same thing that you asked me to do this morning, which is, hey, let's put it all aside and let's work through this. So please do that, because this is a super emotional issue, and it's a factual issue. I mean, I met with the doctors before I met with you, and I told them, look, I want to hear, I'm not saying don't bring your emotion, because that's important, but bring me facts. I need facts, because Spawn says this, and I need rebuttal for facts, so that we can have an intellectual discussion, not an emotional one.
Yes, sir.
But if you won't come to the table, then it's going to be real hard to have a discussion, so I'm just asking,
Commissioner Chesney,
please.
yes, sir. Pleasure of seeing you Tuesday evening. And
I'm sorry,
and I had the pleasure of seeing you Tuesday evening, and mentioned that I made myself available. You called this morning, and I dropped everything. It's needed, okay? There's no pats, no blue
No,
stars,
pat
red
yourself on
stars,
the back
nothing.
for
okay?
that. I appreciate it.
No, and I appreciate the time. I very much enjoyed the conversation this morning. Commissioner Modis, Commissioner Chesney, very much. It was honest, it was straightforward. I told you a story of a doctor in Alice, Texas, named Mauricio Teixeira, that said once to me, I'll tell you everything that I feel. I'll tell you what's on my mind and what I think and what I feel. That way I don't have to remember what I said. Okay? That's it. That's what I did. Okay? I will reconsider, but right now, sir, I cannot give you that word right now. I will follow up. This will not languish. It will not. Okay, but right now, yes, there's disappointment on all sides, but I will tell you, the commitment Spawn has is ironclad. You wanted information. That's from the American College of Emergency Physicians. That's not from Spawn. Okay? That's the number of residency programs today and was in 2007. Those are the true numbers of Spawn's capital commitments to this region. Those are true numbers, the number of people employed by Spawn, and the $285 million in yearly salaries and benefits that go to those that clean our hospitals, do the work. So
Let me be clear, though, also. This committee is going forward. We would love to have your input. I believe it is vital to have your input on it, but we are going to go forward with this committee, and you are not there, then Spawn is the one losing out with the information that they can't share.
Judge, thank you. Commissioners, thank you.
I would ask who is going to be presenting for the physicians. You will get the 10 minutes, or just like the other, and then all the other doctors will get the public comment. Anyone that wishes to speak in the time that we have left, we will get you all up there, as many as we can. I will state again that we are going to form this committee. I would like for it to be 2 people from Spawn, 2 people from the Hospital District Board, 2 from our Commissioners Court. Commissioner Chesney and Commissioner Modis have already agreed. A community advocate, I've already talked to Karen Urban, and she has agreed to serve on this as well. And then I would like to have 2 physicians that are willing to openly come in and discuss this thing. No recordings from anyone. I would like all of you to commit to that we really want solutions with this committee, or at least understanding moving forward. And you've got to have the right heart in coming forward and wanting the best for this community. Thank you. And I'm sorry, if you'll state your name, and I'll mark, I have a whole list of doctors up here that, yes.
My name is John Herrick. I'm one of the associate program directors for the program. And we did all plan on speaking, but I can try and summarize as much as we can in 10 minutes so we can proceed. So first, as I mentioned, my name's John Herrick, and I'm one of the faculty with the program. I first came to Corpus in 1997 for a 1-month medical student rotation. That rotation was at another hospital. I became very intrigued by Memorial Medical Center. My dream was to work teaching residents and to work at a county hospital with underserved patients where I felt like I could really make a difference. At that time, there was no emergency medicine residency here, and I had to go to New York to get the training that I needed. But I kept the names of contacts in Corpus Christi, and I checked in periodically. I heard in 2005 that Spahn was wanting to start an emergency medicine residency. There were great jobs all over the country, but I felt that Memorial was a perfect fit for me. I was the first faculty to move here in January of 2006. We then got the program accredited and took our first residence in 2007. I remember learning about NCHD, Nueces Aid, the clinic card, on my first shift in 2006. And this was an amazing program. I'd come from New York City. I'd been in Ohio. I'd never seen any program that captured so many vulnerable patients and gave them care. They usually fall through the cracks. But with Nueces Aid and the NCHD, they do not. We're the face of NCHD. When an NCHD Nueces Aid patient has an emergency, they come see these docs. When they have a heart attack, a stroke, a major trauma, these are the docs that take care of them. We consider it a great privilege to take care of the NCHD patients. We make sure that they're treated with the utmost dignity and respect. When we're gone, Shoreline is most likely to be staffed by replacements that will fly in and out. They generally work a few shifts and then go to their respective city or wherever they live. They won't know what NCHD is like we do, and I just fear that with the ending of this residency, the care of the NCHD patients will be forever altered. I'll next touch on some of the economic summary there and some background. A Nueces Aid contract stipulates that 2 GME programs must exist. So eliminating EM results in only one program. A fellowship with 2 fellows in geriatrics or obstetrics is not equivalent to the same services provided to NCHD by 36 emergency medicine residents. At the time of the initial contract, there were only FM and EM residencies. The definition of a resident is not equivalent to a fellow. Fellows are graduated residents that are undergoing additional subspecialty certification that is completed after becoming a fully trained and board-eligible or board-certified physician. There's also going to be significant downstream effects, not just in the ER. Many of the trauma surgeons have come to us, one that is going to speak today, and the service would be greatly disrupted. The surgeons come and take jobs here because of working with the residents. There would be substantial attrition of our trauma surgeons, some of whom have already said they're gone, and they feel that the level 2 trauma designation would be at risk. The expense to hire nurse practitioners, additional trauma surgeons, far, in our opinion, negates any cost savings by the Christus system. The lag time to recruit the team of surgeons and nurse practitioners or PAs needed would not keep pace with the rate of the EM residents leaving or graduating and put the level 2 trauma accreditation at risk. The American College of Surgeons just performed a survey with us. They cited the relationship between the trauma service and the ED, mainly the EM residents, as a major strength of our trauma program. We have a lot more than 10 minutes here, so I'm going to start summarizing just freelance. One of the other things that just came up is that no one will have to leave. They will go through 2026. And to be accredited, there are significant hurdles to that. It says that you have to have at least 18 residents at all time to be an accredited program and maintain that. What they're proposing is to phase out 12 per year. So even by definition, in the 3rd year, you would not have 18 residents. So we don't know if Spahn went to the ACGME, the accrediting body, and got special permission to do a phase out, or if they just didn't know about those regulations. We don't know what
like
that phase out is based on. That's not been shared with us.
Sounds like a good question for the group, yes.
Community impacts. We have a track record of strong commitment to our community. Go back to the COVID days. So the hospital was far overwhelmed with the number of doctors needed, and usually systems don't cross. So there's ICU doctors, there's ER doctors. So in July, when COVID hit, there was the ICU team normally takes care of, I believe, 40 or 50. Their service swelled to 150. So special shifts were created. I worked the first day. We all worked extra shifts, not in the ER, upstairs, taking care of the COVID patients, managing the vents, running the codes. And with the loss of a residency, you're losing 36 bodies. For the next pandemic, Corpus would be very differently staffed. And if you have
Please define vents for our.
ventilators, emergency medicine physicians are skilled in critical care, able to take care of ventilators and intubate patients, place central lines, advanced
These are patients that
technique.
are about to die and can't breathe on their own. Thank you.
Thank you.
Another, along that same lines is hurricanes. We're prone to hurricanes, so when the last major hurricane, we divide up into teams and we stay. We don't leave. So if you have outstaffed physicians flying from out of town that are not even here, they're not even going to be able to get here to work their shifts, versus we live here, we stay here, we took care of the patients. How many hours did people stay? 72 hours in the hospital, sleeping in the hospital. So the
I
community
have to ask you
would
to wait until you're public
Okay.
speaking, please, before this gets out of hand. Yes.
So the community would be much less prepared for any future natural disaster that came. Just some of the personal and business impacts. 50 families moved here with the residents. We have 36 residents and 16 faculties. There's been mention that they would find us other roles in SPAN. So we are all emergency medicine teachers. So there is no other emergency medicine role similar. So there is no other job for us in the SPAN system. So the next closest emergency medicine residencies are San Antonio, Austin, and Houston. So there are no equivalent roles in the system for us. We've talked about the trauma service. Talk a little bit about the finances or the unaffordability of the residency. We staff the emergency department with 6 doctors, 2 attendings, I'm an attending, some of these are my fellow attendings, and 4 residents on at all time who are also physicians. So there are 6 physicians in SPAN ER at any time. If 4 are gone, maybe they could get by with, if 4 of the residents are gone, there's just 2 attendings, maybe they could get by with 4 total instead of 6 total. But just to pay for 2 more of us is approximately $5 million, which is the whole cost of the residency right there. And that's not including on the trauma service in the MICU. We have 3 residents on each of those services, and they work hard. They work 80 hours a week when they're on the MICU. So just to replace with a nurse practitioner that worked 40 hours a week, the trauma team, the trauma director estimates that he would need 4 to 6 nurse practitioners to replace on his service at 3 to 4 times the cost. So the financial, and other people have called when I talk to other CEOs, they don't get it. So as far as the cost for that, other cities are clamoring to start emergency medicine programs, sometimes for the wrong reasons. Sometimes because they're so profitable, because they provide so much labor for the hospital. So we don't know what SPAN is doing differently that everyone else is wanting to start, and we are the only one in the country being closed there.
We're about at that time. Do any of the commissioners have anything you want to say before we move into public comment? I would like to ask if y'all could get back to me with 2 names of physicians that are willing to participate in this with the requirements that I asked. And if you could get back to me anytime soon, we would like to get this started as soon as possible. Yes. I know we have some hospital district board members, and I would ask Art Granado, if he would serve on that for the hospital district as well. And I see Dr. Reddy in the back, if you would serve as well, if the two of you would agree right now, then I have my commissioners, the hospital district, and hopefully another one from Spawn, and then the two doctors, and I know Karen Urban has already agreed, so the sooner we get this moving, the better discussions can be made. I'm not sure what kind of solutions we can find, but we all want to do what's the best for this community.
I appreciate it. Thank you, Judge Scott. Thank you,
Thank you.
commissioners.
Thank you.
Can I ask a question?
Yes, please. Yes.
Dr. Herrick, we got some information provided to us. It wasn't signed by anybody in particular, and I don't even know who submitted it.
We as a group worked on that document.
Okay, so that was submitted by you as a group of
Yes,
doctors on that?
yes.
That's, next time, just put a signature on it, that way.
This is my first time being in a
okay.
format. I'm a
No,
little nervous. I'm sorry. Next time I'll
It's
do
okay,
better.
we just want to make sure it's, from you. And then-
Legit. Yeah. Most of the time, yes.
So, the question that I've heard a lot about is on the retention, that we don't retain a lot of the doctors out of the program. Could you kind of talk to that specifically a little bit too?
Definitely.
There's
So,
so much, like I said, there's so much going around, I don't know
Yeah.
what.
So, I can look at these three gentlemen right here. These are all graduates of the program that Dr. Brodeur, we kept straight out of residency. Dr. Peterson had a 4-year military commitment and served and came right back. Dr. Cambron also went somewhere else for a year, but was just got back here as soon as he can. So, outside of that, we have about a 50% retention rate here, and it's not just Spawn. There are other competitors in town. There's Physicians Premier. Physicians Premier has 5 locations in town, and those are mostly staffed by our graduates, a huge percent of them. In fact, 3 of the medical directors of the different premiers are all our graduates. So most of emergency medicine and a huge percentage of the doctors in town are from our program, and that extends to Alice, Beeville, and Kingsville too. One more, facts. You wanted facts. So out of the graduating class, out of the 3rd years, they're already looking for jobs next year. We have 4 that want to stay in the community out of the current graduating class, and since this has happened, they're looking elsewhere. So that's just another loss and another example, and that's about an average percentage and is higher than, I would say, the national average of retention. So people love Corpus, and a lot of we've got people that have stayed from Vermont, from seems like the further they're away they come and they want to stay. So we've had people from all over the country become Corpus Christians.
And what I read in here says last year alone, 6 out of the 12 graduates stayed here actively working in our community. Is that accurate?
Yes, we have, overall, I know most of the stats, we've had 109 of the graduates work or provide some degree of service. Some of that would just be moonlighting or during their 3rd year and fill the Allison, Beeville, and Kingsville shifts, which is another factor. They rely heavily on our residents to staff that, and those are all going to be cost shifted. There's significant bonuses and things like that have to be paid. So there's a huge pipeline of needed physicians that will be lost.
Well, and to me, that's very encouraging, because honestly, if you didn't retain any of them, I'd still say this was a great program, because we get all these people while they're here, and you get 36 people that are working in the community plus the faculty. So whether you retain them or not is not super, well, it's important, but it's not that compelling for me. But it's more compelling that 6 out of 12 stayed last year, and people are staying. So
And that
was some of the misinformation that was flying around, that people weren't staying here. Unfortunately, that's why we're doing this, is to try to get the truth out.
And that would be
and
the
facts.
norm. So let's say the markets are tighter in Austin and places like that. So people may just go for training and not retain, because in the San Diegos and the places with great weather and people are just allowed to come and train, and then they have to leave because there's no spots. The fact that we retain any physician shows that there is a need here for the physician. So the fact that we have been able to, we have positions for 4 waiting shows that there's great need for that. And I can speak to, that ACEP study that was just quoted as trying to use, that's the American College of Emergency Physicians. So our specialty was hurt. They predicted that there might be an oversurplus, so that came out in 2019, I believe, is when that study came, and they said there may be a great surplus of emergency medicine physicians. They've already taken that back. What they didn't account for was such a high rate of attrition of physicians in COVID. People got burned out, many died, were permanently injured, so they have reversed their position on that study. Even in our own class, we did see a reduction last year in a slight number of applicants. This year, that had already reversed. We've been asked, we've had to shut down, our recruiting. So on the first day that we opened up our recruiting, it's a national match program. We had 600 applications for the people that wanted to apply to our emergency medicine program. So 600 people that are willing to come to Corpus Christi, and we have to whittle that down to 12. The fact that they say there's an oversurplus, not here. Maybe there are in the San Diegos and other places that people really want to go, but I love Corpus, but it is a traditionally hard place to recruit for physicians, and Dom alluded to that as well.
I've always felt if you can get people here, they'll love it, and they'll
Yeah.
stay, but it's hard to recruit them to come here until they get here and realize what a wonderful place it is. I mean, I've heard that from businessmen all over South Texas. It's really hard to recruit them here, and so the fact that you have them here and have them captive, if you will, and they can get involved in the community.
Yeah. So
Well,
we try and
you
get
know.
them here just to
Right.
rotate, even as a month medical student. If we can get them here for a month, then we know they'll rate us high, and we can get them. People come here, they see amazing stuff. Corpus has a lot of pathology and a lot of sick patients, so they get to do a lot in the residency, and they want to come back. So that's exactly right. If we get them here, we can keep a lot of them.
Well, and I don't want to let other people talk, but as the associate director, program director, one thing Mr. Dominguez and I did agree on, the reputation of your program is spectacular. It is one of the best in the country, and Spawn should be proud of that, and you should be proud of that, and all the doctors in the room should be proud of that as one of the things. So it's even more befuddling to me that we want to shut one of the best programs in the country down, and we want to take 52 people that do emergency medicine out of our community. That doesn't make sense to me, but hopefully as we move forward, we'll be able to have some more of those conversations going forward. So again, I want to let other people talk, but I really want to congratulate you and your program, because it is, nobody questions. You're getting the top of the top from the recruits. You're getting your top 3 matches. You're getting everything you want, and it's because you're so good. And believe me, I don't think anybody's arguing that point during all of this discussion. So congratulations on that, and thank you for being here.
Thank you.
Commissioner Matos would like to speak.
Sure. Judge, I thank you for calling upon that committee, and I agree, we want willing partners to be a part of that group, and we hope that every party is represented, because that's the only way it's going to succeed. I will say this publicly so that we don't forget that there are funding sources that we have locally, obviously through the Nueces County Health District, and we appreciate their partnership that have helped us throughout the years with the county's budget. But also, is there a way that we can look at incentivizing recruitment, maybe the program itself, right? We don't know all the details yet. We know some of it's proprietary, because it's a strange mix of having a non-for-profit hospital working and doing the indigent care. So that's our part, that's our buy-in, that's our commitment to the community. But I think of my time, anytime I'm with my doctor, just so you know, or a healthcare provider, I always feel like, like with a priest, I feel like, let me just spill all my guilt out and share that my accountability for myself, and not as an excuse, but as an elected official, is tough. I'm sure medicine has got to be even worse. So you do things that, you know, you overeat, you do things, you don't exercise because you're meeting early, you're meeting late, you don't do a lot of things that sneak up on you. And so I've been in those beds at Spawn Shoreline. My family members have been there, lost family members there. And the quality of care that y'all provide is remarkable. And I can imagine how y'all survived during COVID. And I always thought that would be the toughest test that we found. And it's unfortunate that this decision has been made. But I always try to be optimistic in that we have this discussion today to be able to move forward. I thank the judge for calling upon a committee to come together. I think of my daughter, who's a student at UT right now, who one of their calls in one of her classes, which I don't even know what kind of biology or chemistry class she's taking, she's so brilliant. She's looking at medicine or research, and they're talking about finding the new set of, what is it, antibiotic-resistant drugs or whatever, right? Something like that. She told me, and it just went right over my head. I want her to come back one day, and if she goes into medicine, I think this would be a great place to start, and hopefully to be with close to family. But, you know, in looking at this, I feel that we are taking the right steps, right? We cannot be the only part of the solution, but we can be a great part of it, right? So I hope that today, with this call to action that we've had from the judge, from the majority of the court, from our partners here, that we're going to make it happen. And so this issue is not going to go away. We're going to continue to discuss it. Hope is a great thing, and we'll, and you know, I hope that this will help with our recruitment, our retention, that we don't lose anyone. Because I agree, we have a beautiful community, and if you have any visiting physicians, only bring them between right now and April, right? We know that they will dread the summer, but that's something totally different, right? But thank you all for your work, and you have my commitment to be on this committee. Thank you, Judge, to put all our effort into trying to find a solution. Thank you.
Well, I assume if the talks do, and I hope they do happen, we're a reasonable group. We are willing to negotiate and compromise where needed and do all that in good faith. I can assure you that.
Thank you.
Thank you. Thank you all for being here and huh?
Can I say something?
Oh, yes, I'm sorry. I didn't know you were.
Well, I mean, it's ironic that we talk about communication and with each other in big groups, and, well, we have the same problem here because there's only 5 of us, and I didn't know we had a committee. So.
We just formed it, just now.
Well, I didn't know.
This is not.
We formed it before today. But anyway, I just want to let you know that just communications are both ways, right? And, you know, and I really care for residency. I really support it. But I look at both sides too, right? It's not just a one-sided thing. We can blame wherever we want to blame, but it's 2 sides to everything. Everybody has a story. I wish I would have had all you guys support the Hector P. Garcia when we were doing the Hector P. Garcia. That's what we needed, you guys, to support the Hector P. Garcia.
You did. I was at the ribbon
Yeah,
cutting.
you
I
were-
was there.
you wanted-
I
well,
was
cut the ribbons
absolutely
not.
there.
When we had the fights, never, very few of you were there when we had the fights. And that's the indigent care. That's where I really would, to me, my passion is the indigent care with the hospital district. You know, and I don't know how many doctors are gonna go work with indigent care when they leave Spawn, but I don't, the doctor you mentioned a while ago, how many of you actually work with Spawn, the ones that are graduated?
How many what?
No, the ones that 3, he was talking about 3 doctors.
All of you.
All of you work
do.
with Spawn?
Uh-huh.
Well, good, congratulations, because that's really what I look at. Who's gonna stay and work in Spawn, you know? Because if you train them, and you can go anywhere you wanna go, then we're spending money that we shouldn't even be spending, to me, right? I mean, I think Spawn probably should have a 2-year contract once you graduate, that you gotta stay at Spawn. Because, yeah, everybody wants you when you graduate, but nobody wants to pay for you when you go in training. That's where if everybody would get together, all these ERs, all these hospitals, and they say, come to the table, okay, we're gonna help pay for those $280 million that are being spent by Spawn. Just, you know, and then you can have wherever you want when they graduate. I'm just looking at both sides here, because I think when they graduate, they should have an option, but I always say we should have a contract when they graduate to stay there at least 2 years. You know, we lose police officers like that, we'll lose sheriff's officers like that, because we train them and we lose them. You know, and when I saw this, when Commissioner Chavez talked about those 6 that So I say, how many of those 6 actually work for Spawn? You know, maybe 2.
We have a
3.
great retention rate,
Yeah.
and we
Yeah,
can
well, the
provide
retention-
names and
The retention
things
is
if
here
it's helpful.
locally, but I don't know if it's for Spawn, but, you know, that's what I'm saying, maybe we all need to come to the table and everybody put a little, you know, take a little skin in the game, put a little bit of money and say, here's the money to train the people. We're gonna hire, wherever they go when they graduate, that's good, you know? But my concern is also the ER. My concern is also the fact that the waiting time, I hate to wait in the ER. I
Absolutely.
hate to wait.
So,
And I know it makes it easier with the residency, but if Spawn is committed to hire 3, 4 more doctors, and it's a commitment, I'd like to hear that too, to see what their commitment is. You know, I know the residencies help, but I'd like to hear what's the commitment from Spawn? Are they willing to make an open commitment to say, hey, you know what, we're gonna hire 4 more doctors in the next 2 years, 5 more doctors? They need to come to the table too and say what they're gonna do. There's only 2 residency programs here that are required to have, 2. It didn't say which ones, it just says 2. The only one that's mandatory is the family medicine residency. That one we gotta have. The other one is not, it was was created by Spawn. So if that goes, they have to replace that with something else that's gonna benefit the community, I think. So I understand. So I might be wrong, but you know, again, so I think that residency, there might be something else out there that's gonna be just as good. It's gonna benefit the community. We don't know. I mean, we can't just shut the doors to everything else either and not give something else a chance to grow like the residency grows. But if you wanna keep the resident, maybe we need to get together and say, hey, how much are we all putting on the table? And we can make it work and keep some of the residency because we're all pitching in, but still have another residency that the Spawn's gonna bring in. Nothing wrong with having 3. I mean, you know, we can 4. I mean, I don't care, but you know, who's gonna pay for them, right? You know, we all want somebody that's trained and ready to go, but nobody wants to.
I can speak a little bit to some of the frustrations with waiting times and things like that. So I was here getting the program accredited, and I worked a shift at Shoreline. I was a Memorial doc, but I came over to Shoreline. I will never forget the first day I worked there with no residents. There was 17 charts in the rack, which means 17 patients that had been waiting all night to be seen. And the first 5 or 6 I saw were deathly ill. Low blood pressure, heart rates of 150, and there's no way they should have been waiting with those wait times. With the residents, we've solved that. We solved that the day the residency moved from Memorial to Shoreline. The metrics decreased greatly. Now all waiting times are based on nurse staffing. So there's not enough nurses to staff the beds upstairs, so they hold patients in the emergency department. So we will go to the waiting room and see people. We work in triage to try and decrease waiting room times to get tests ordered. If we know they need an x-ray, we meet them up front, start the workup, draw blood, and get it. So the waiting time has decreased significantly with the residents. No matter what staffing model they go back to, they will not have 6. That is astronomically, that would, to go to 6 would be, just paying the hourly rate that we did would be $10 million a year to staff it with 6 doctors. And we work for much less, about $20 an hour less than the average Texas ER doc because we like what we do. And we have never taken a shift bonus to work at Shoreline. We make our own schedule. So starting July 1, the costs are going and waiting times are going to go back to what it was on those first shifts. So that's probably another thing that's important to understand is this doesn't start in 2026. So if there's no new class, all the hospital staffing is based on having 36 residents. So there are gaps starting July 1st that will affect waiting times, trauma care, accreditations, and kind of the snowball effect.
But the residency isn't in until 26, though, right?
No, they're proposing that we not take a new class. So starting July 1st, there would be 24. So there's 12 residents, first-year residents, there's 12 second year, and 12 third year. They are proposing that we do not take a new class, so July 1st, we would not have a new group of 12 residents. We would still have 12 second years and 12 third years. So it would go to 24 residents starting July 1st. If none of them left. These guys are superstars. This is out nationally. They have Ivy League places wanting them, so they're going to have to decide if they want to stay here or not.
Well, I think all doctors are superstars, right, because they take care of you, you know, especially the ones in trauma. You know,
Appreciate
I
that.
admire those a lot. Trauma doctors are my favorite, right? So, but the thing is, let me tell you, when I go see, what bothers me, we ask for more doctors, but when we go see our doctor, you know, I see a PA. You know,
Well-
three times in a row, I go and see my doctor and I see a PA.
So that's,
I
when
don't-
these
I
doctors
don't
are
pay-
gone, they
I don't
will
pay
be
for a PA, I pay
replaced.
for a doctor, right? But I get charged the same amount of money. So are we short on doctors, or doctors just don't wanna?
Everywhere.
You know, I
Yes.
mean, the
National.
PAs, I mean, the PAs do a good job, don't get me wrong, they do a great job. But maybe we need to hire more PA, may have residency for PAs, I don't know, maybe it's a good thing to have. Everybody's using those PAs now.
We work with we call them nurse practitioners or PAs in PPAs, but that's what, who these docs will be replaced with, just from financial realities. You can't afford to replace a resident doc
Nothing
with
wrong with
that.
that, nothing
so.
wrong with the PA. So, anyway, that's, I'm sorry. Judge, thank you. Well,
Thank
thank
you.
you very
Thank-
much, I
thank
appreciate
you.
it. I just
Thank
hope
you.
we
Thank
can
you,
work this
Commissioner.
thing out, Judge, and, I don't think we have any, I don't know why we even have a committee other than just talk, because, I mean, we can't tell Spine what to do. You know, we can't tell the doctors what to do. We don't have a contract with them. You know, we're not in contract with anyone. The hospital district has an agreement, right? I have an agreement, and they kept that agreement, you know, so they got to have two residencies. When they get rid of one, they had to put another one. So, I don't know here, I just don't, you know, the hospital, I don't even know either one of you went to the hospital district or not. But if the doctors didn't go and Spahn didn't go to the hospital district, shame on you, you know, you should have gone first to the hospital district. So, okay, thank you.
Thank you. Commissioner Hernandez would like to speak first, and then we're going to get everybody started on the public speaking, 3 minutes each.
Yes, Judge, for the sake of time, I just want to say that I like the idea of forming this committee, and thank you to the gentlemen that are volunteering to participate. The faster we get this committee going, the better it'll be for the community, so we can get things done right. Thank you.
Commissioner.
Thank you. I am just going to start down the list, and you will have 3 minutes. When you get up to the podium, please state your name and address. I have this list that was emailed to me. I assume this list wishes to speak publicly as well. I don't know where Peyton is, where I got it, I assume. We'll start with Dr. Sandra Williams.
Can you pull that mic up, please, because thank you.
Yes, so everyone can,
Sorry, I'm
please
a little bit tall
Yeah,
here.
you,
state your name and address as well.
So, good afternoon, my name is Sandra Williams. I am not a Nueces County resident. I live in Houston, Texas, and I practice in Angleton, Texas. But I am currently the president of the Texas College of Emergency Physicians, and we are the professional organization that represents over 2,100 emergency medicine physicians in this state, as well as all of the emergency medicine residency programs in this state. And the first thing I want to talk to you guys about is what exactly makes an emergency medicine residency trained physician. We go through a lot of training and a lot of schooling that makes us very different from those such as a physician assistant or nurse practitioner. We all go to undergrad and get a degree in something. And after that, things change. We go to medical school. It is 4 years. 4 grueling years of didactics and hospital and clinic rotations, where we learn little tiny bits about the variety of types of medicines out there, such as cardiology, neurology, and pediatrics. We then choose to specialize in emergency medicine and do this program. The residency program is 3 to 4 years, where we learn and hone a very unique skill set that makes us the best qualified providers of emergency care. We do this with bedside care every day in the emergency department with our already residency-trained emergency medicine physicians. We are there 24 hours a day, 7 days a week, 365 days a year, providing this exemplary, high-quality care that
If
is.
you could speak in a little bit, I'm getting a message that they can't hear you in the back. I'm so sorry. I know you're
Sorry.
tall and it's not gonna, you may have to pick it up and hold it.
Sorry.
You may have to just take it out of
I
the,
feel like
yeah.
a singer here doing this.
I'm so sorry, thank you.
Okay. But allows us to provide very high-quality, unscheduled emergent care to a wide variety of patients. We learn how to very effectively and efficiently take care of a very simple pediatric fever, a patient with abdominal pain that winds up having appendicitis, while a patient's having a heart attack and another one's having a motor vehicle crash. We do all that very effortlessly. The other specialties out there, such as physician assistants and nurse practitioners, do not have anywhere near the training that we do. They finish undergrad and get a 2-year degree, and that's it. There is absolutely no comparison. You should want the best care for yourself, for your family, and for the other members of this community.
Very good,
Thank you, ma'am.
Thank you.
Thank you.
very good.
Dr. Brian Dunn,
He's tall too.
you have to hold it as well.
We'll pass the baton.
State your
Honorable members
name.
of the court, thank you for the opportunity to address this most important subject. My name is Brian Dunn. I live in Boerne, Texas. I'm residency trained and board certified in emergency medicine. I'm currently the medical director of the emergency department at Connolly Memorial in Floresville, as well as chief of staff of the hospital. I'm also secretary of the Texas College of Emergency Physicians. I've been in practice for over 30 years in every setting, from a level 1 trauma center to remote sites on Indian reservations. I grew up not far from here in Hebronville and Kingsville. My dad was in the Border Patrol and my parents still live in Kingsville. My father and older brother were both born at Shoreline Hospital. Given my roots, I've always been concerned about people in rural areas and the type of medical care available to them. For many years, I would go to the emergency department at Christus Spohn Hospital in Kingsville and work several 24-hour shifts a month in an effort to give back to my hometown and to help bring state-of-the-art emergency medicine there. I was the first and for many years the only residency-trained EM physician to work there. Rural hospitals have difficulty in attracting residency-trained EM doctors. For the majority of the day, the physician in the emergency department typically is the only doctor in the hospital. Large national contracting groups frequently have to place physicians, NPs, PAs who are not trained in emergency medicine in rural facilities. These physicians do their best, but they don't have the specific training needed to deal with literally everything that comes through the door. The Christus Health Texas A&M Spohn Emergency Medicine Residency has been a tremendous source of highly trained physicians for the hospital in South Texas. The senior residents as well as the faculty work in multiple hospitals and towns in the area, serving a tremendously underserved population. In general, when residents complete their training, they either go back home or they stay where they trained. As we've heard here, many of the residents choose to stay here in this area. As I did when I was much younger, many of them come to love the climate, the culture, and the people of South Texas. As is the case with many issues, there are national concerns and local concerns. As the saying goes, all politics are local. Nationally, as well as in Texas, we have many emergency medicine residencies. When I trained, there were no EM residency programs in Texas. As it stands now, there is only one EM residency program in South Texas. Only one chance for South Texas to train the best and the brightest, and to have a large percentage of them stay here with their families, contribute to the economy, and provide state-of-the-art emergency care that many demographically similar areas will never have. Over the years, as my parents got older, when they contacted me with a medical question, and I knew they needed to see someone right away, I directed them away from Spohn-Kleberg and had them come to Corpus, knowing that the likelihood of them seeing an EM physician in Kingsville was very low. My dad is now 90 and experiencing many of the things that 90-year-olds do. I'm now perfectly comfortable with them going to the ED in Kingsville, knowing that the majority of the time, a trained EM physician from this residency program will see them and will do what I would do. I'm sure you want the same for your communities, your friends, and your families. If this residency program is in jeopardy due to economic or financial concerns, please investigate whatever reasonable alternatives may exist to keep this priceless resource here in South Texas. Once it's gone, the prospects of getting one back will be very grim. Thank you.
Thank you. Marilyn Brodeur. I'm shorter. Thank you.
I'm Marilyn Brodeur, 600 Elizabeth Street. My name is Dr. Marilyn Brodeur. My husband of 16 years I'm Marilyn Brodeur. My husband of 16 years is Dr. Michael Brodeur, who is a core teaching faculty at the Corpus Spawn Emergency Medicine Residency Program. I'm a dentist. At 20 years old, I was the youngest student in my class at the University of Maryland, Baltimore. I then trained at Johns Hopkins Dental Residency, where I cared for the dental needs of medically complex patients, many times treating in the operating room. I'm now a stay-at-home mom to 4 children, but I can speak medicine. I would like to urge this body that if a decision is not made soon, this residency program is in the midst of an interview season that was terminated. And the interview season ends in January. Every single week, there are multiple students from all over the country who are coming to Corpus. The trust has been shattered. The reputation of this program has been shattered. And unless something is done in a timely fashion, this program will be severely, severely limited. The quality of applicants will decrease, and we will not have the amazing care that happened at Spawn Shoreline. The medical director told me that before the residency was at Spawn Shoreline, the wait times were 80 minutes. Once the residency moved there, as of right now, the average wait time is 23 minutes. The admit rate at Spawn Shoreline is 60%. That means those patients are so sick they can't go home. They have to stay in the hospital. 60%. The average across the United States is 15 to 20%. These physicians are so needed in this community. And frankly, it is terrifying that Spawn would make this, in my opinion, extremely reckless decision to completely kill this program. These residents will leave unless a decision is made soon. If this program is not restored in a timely fashion, it will die. These residents make under $15 an hour when they are working in the ICUs. Why are these 36 salaries such an onerous burden to bear when Christus Spawn employs over 3,000 people? We heard that directly from the CEO. What about these 36 salaries is too much for Christus Spawn? Why were bonuses announced on Monday? And did any Spawn executives also receive these bonuses? It seems like there's a misrepresentation to me of the money. Thank you for listening to my comments.
I'm going to ask you to please don't do that. Please, no clapping or commenting out loud. This is Avery Tomanek.
(3610) Lake Champaign. Hello, my name is Avery Tomanek, and I am in 7th grade, and I attend school at River Hills Christian Academy. I am the daughter of Dr. Tomanek, the program director and an Aggie doctor for Texas A&M ER residency program. I asked to speak here today myself, and I wrote this speech myself because I know how important this residency program is to a lot of people, and it's also very important to me. Residents and attendings move here from all over the country to study and teach at this program. A lot of the graduates stay in Corpus Christi, working in the area, and care for people like my grandparents, my great-grandparents, both in Alice and Corpus. The residency program is special to me because I have made such good friends with all the residents and attendings. I remember when my mom would take me up to the hospital, and I could just see all the residents training in action. It was so special, and I know a lot of kids don't experience that. Here in my hand, I hold over 3,000 signatures that signed our petition to save the residency program. This is why the emergency medicine residency program needs to be saved. You need them. Corpus needs them. We all need them. Thank you for your time.
Thank you. Grace Leeson.
Hello, Judge Scott, physicians, families, and friends. Thank you for allowing me to speak today. My name is Grace Leeson, 4926 Greenbrier Drive, Corpus Christi, Texas, 78413. I am the daughter of 2 emergency medicine physicians. My parents' brother and I moved to Corpus Christi, Texas in 2008, where my parents found their dream job. My earliest memories in the city are related to my parents and their job as doctor-teachers. I began elementary school at Incarnate Word Academy. I remember my parents presenting talks to my classmates on career day. While I don't remember exactly what they told my peers, I do remember the incredible sense of pride that I felt as my parents stood, dressed in white coats and blue scrubs. To this day, I am overwhelmingly proud of my parents. As I grew, my interactions with the residency program increased. My family frequently brought my brother Drake and I to the hospital for what our family calls the trade-off. We would sit in the doctor's lounge and watch cartoons on Channel 44 while our parents relieved each other from shifts. When my parents led resident class, my brother and I volunteered to serve as ultrasound models for the practicing residents. Why did we let doctors poke our tummies and look at our guts? Because these doctors are superheroes. They save lives. They care about us, and we want to be close to them and help them in any way we can. I shadowed physicians at Christian Spawn throughout middle and high school. Last summer, I was a research associate at Christian Spawn, where I assisted residents in completing research designed to improve healthcare in our community. Inspired by the mission of Christian Spawn residency program, I am pursuing a career in medicine. I'm a sophomore at the University of Notre Dame in Indiana. I'm double majoring in English and pre-medicine with a minor in compassionate care in medicine. I study English amidst medicine because I value effective communication in healthcare. I'm minoring in compassionate care in medicine because I value justice for all patients. The closure of the emergency medicine residency program will be a grave mistake. The physicians involved in this program care about this community. They are incredibly successful, intelligent, reliable, and selfless. They have provided care to Corpus Christi amidst Hurricane Harvey, the COVID-19 pandemic, and the freeze in 2021. These people want to continue to serve us through healthcare. Let them continue to take care of us. The emergency medicine residency program is a family. They care for the community and they care for each other. Please do not tear this family apart. Please do not tear my family apart. Please do what is right for this community. Thank you for your time.
Thank you. Dr. Craig Peterson, or I think it's Peterson, yes, sorry, yes.
I suspect I'll need to pull out the...
Yes.
Thank you for allowing me to address you today. My name is Craig Peterson. I live at 15630 Gypsy Street. The views I'm about to express are my own. They're not the views of Christus or CS Partners. I'm an emergency physician and attending and core faculty within the emergency medicine program at Christus Spawn Shoreline. I'm privileged to work with amazing people in that ED. I'm here to tell you that the abrupt and, in my opinion, unwarranted closure of the emergency medicine residency program at Christus Spawn Shoreline is a spectacular tragedy for the future of emergency care in Corpus Christi and the Coastal Bend. In 2011, my wife and I took a chance and moved to Corpus Christi from Fort Worth for their last 2 years of medical school. This program easily became my top choice. I received an amazing education here, and I was honored to serve in the role as chief resident. After residency, I went on active duty with the Air Force, and my wife and I and our brand new baby moved to San Antonio, where I trained residents at Brooke Army Medical Center. When I described this program to them, I would regularly hear terms like unicorn or hidden gem. I never disagreed. I enjoyed success there as an educator and was named Faculty of the Year twice in 4 years at BAMC. After deploying and completing my active duty service, I returned to this residency as soon as I can. For me and my family, the choice was easy. This program was clearly special. We moved to Corpus in May of 2020, just before the height of COVID. Hospitals across the country were reeling and failing. The emergency medicine residents here placed themselves in harm's way routinely. They cared for the most critically ill in our community. The emergency medicine residents were the ones in the EDs and ICUs, intubating and helping to provide oxygen to patients. They were holding iPhones so that you could talk to your loved ones when you couldn't visit.
And sadly, they were holding the hands of those that passed so they wouldn't be alone. There are 15 faculty and 36 residents in this program, and we were stretched to the brink. Without the emergency medicine residency, the situation would have been even more catastrophic. Today, emergency medicine residents meet trauma patients in the resuscitation bay, acute stroke patients at the CT scan. They emergently deliver babies whose mothers have had no access to prenatal care. They treat your children at Driscoll, and they watch over the most sick and injured in the ICUs. They help staff our rural hospitals in this region, improving access to quality care for those underserved communities. If I become critically ill, I want to look up from the bed and see our team of physicians watching over me. I was so sure that I wanted to spend my entire career here that I helped my parents move here at the height of COVID and my in-laws a short while later. We've invested in this community. I volunteer with CCPD and CCFD, and I'm the SWAT medical director. I train medics to save lives. Every year at Christmas, this program donates money to Mission of Mercy Free Clinic. My family is active in our church, and my wife teaches at my son's school. Our resident spouses are nurses, teachers, paramedics, and family physicians. I wasn't born here, but Corpus is my home. You are all my neighbors, and this residency is my family. Please help me save it. Lives depend on it. Thank you.
Thank you. Dr. Michael Halpert.
Judge Scott, commissioners, and fellow Nuecenans, I appreciate the opportunity to speak with you today. My name is Michael Halpert. I live at 245 Rosebud in Corpus. I am a resident of Nueces County and a recently retired physician and surgeon. I am not a politician. In the 40 years since I graduated from medical school in San Antonio, I've spent 9 years as a military physician, nearly 2 decades in private practice, several years as medical school faculty at Texas Tech School of Medicine, and the last 5 years of my career before I retired earlier this year as a trauma surgeon at Shoreline Hospital. I know how valuable good medical care is to a community, and I know what it takes to run a successful physician training program. I simply cannot believe that we're going to lose this program. I've seen a lot of places, and let me tell you, as others have said, this place is a gem. It is a major league quality program that is not expected to be found in a place as small as Nueces County or Corpus. It attracts the top young physicians from around the country and has a reputation that other programs envy. I worked with these residents every day during my 5 years at Shoreline, and I could not have provided the quality of care that I did without them. Nueces County and South Texas are short of physicians, and the best determinant of where a young physician goes into practice is where he or she trained. Most cities would be delighted and proud to have a program like the one that Shoreline is closing. I just can't believe we're closing this. It's incredible. As I noted, I was a trauma surgeon before I retired. The trauma service was surveyed by the American College of Surgeons this past January. As Dr. Herrick noted, the surveyors, who are very hard to impress, commented on the unusually high degree of cooperation and teamwork between the emergency medical staff and the trauma surgeons, this teamwork that saves lives. This is entirely due to the enthusiastic participation of these residents in the trauma program, and without the residents, the quality of trauma care will suffer. The residents are also the backbone of the medical intensive care program, and of course do the majority of care in the Shoreline ER. Mr. Dominguez stated that this closure will absolutely not impact the quality of care that patients receive. He simply cannot believe this. How can the closure of a program that attracts the best and brightest young physician trainees to our county, many of whom remain here to practice, not impact the quality of care? Judge Scott, commissioners, you have significant influence in the operation of Shoreline Hospital. Please do what you can to reverse this short-sighted decision by Shoreline administrators and preserve this vital resource for the people of Nueces County and South Texas. Thank you for the opportunity to speak.
Thank you. Dr. Brooke Danbois.
Commissioners.
I'm kind of hopping around. Sorry, everyone. I know we're going to have to stop before this, so I'm trying to just pick random names. So,
Judge, my name is Dr. Brooke Danbois. I'm a military veteran, a graduate of the Corpus Christi Emergency Medicine Residency Program, and a current faculty member for the program. I work in Kingsville, Alice, Shoreline, and at CHOSA and Driscoll. most of the comments I was going to make have been covered. So I'm going to take just a minute to explain to you who these residents are. They are fully trained physicians here expanding their emergency medical training. I started this program in July of 2020 in the height of COVID. We staff not only your emergency departments, but also your trauma ICU and your medical ICU. 2 months into my training in COVID, I was covering 10 ICU patients alone as a resident, meaning that I was responsible for every aspect of their care, from how they were ventilated, from how their heart kept beating with medications, to how their urine output went. I'm going to tell you one patient story. I had a 40-year-old man who came in, and he had 2 children. He also had a wife. Within 1 day of his stay at the ICU, he was intubated. His children stood by and watched while that happened. 36 hours later, his wife had decided that he would not undergo cardiopulmonary resuscitation, so nothing would be done because nothing could be done to save him. I stood in that room with another resident 36 hours later and took the tube out while his children stood outside of that door crying. There was nothing we could do. There was no one else there to provide care for him. That is who your residents are. They are not just staffing your emergency departments. They are staffing your ICU. They are not equivalent to an advanced practice provider. They are not your NP. They are not your PA. They are here to protect and support your community with everything that they have. 24 hours after that, a code was called on the floor. Your residents respond to those codes on the floor while they cover your ICU. I went to that code, and it was this children's mother. It was COVID. She had a breathing mask on. We did everything we could, and I had to turn around and tell those children that their mother did not make it as well. I was trained as a casualty notification officer in the military, and I never thought that I would ever have to use those skills during my residency. But I came to this program because it is a gem, because it offers something that nothing else in the Coastal Bend will offer. It is something that is unique to Nueces, and you should do everything that you can to ensure that you retain this program and retain the physicians within it. Thank you.
Thank you. Crystal Tresidor?
I just wanted to say,
You state your name and
I'm
address
sorry.
first. You're
I'm
good.
a little distracted.
No, you're good.
My name's Crystal Tresidor, 1202 Cornerstone, Corpus Christi. I just can't say how much it means to me personally that you would convey this session today. I don't really feel like I need to speak for our residency program. They have covered that. What I want to speak to you from is from my perspective, and this is my independent opinion, regardless of who keeps the bills paid in my home. But I started in EMS here in 1992 as a paramedic. I was here well before the residency program started. I had to sit and think. There was a time that when Memorial Hospital was here, regardless of what was going on, because of the esprit de corps and the moral compass of those folks that manned those emergency rooms, of how they behaved. And then when the residency program came and the way that that blossomed into being able to provide that depth of care that has already been mentioned. I've done critical care transports in this city since then as well from these rural facilities. And to have those emergency medicine trained folks manning our rurals, think about how long it takes anyone to drive from Kingsville to a level 2 trauma center. I'm going to tell you, it matters. Those initial minutes of stabilization, I understand there's a divided focus and we need more primary care and we need more things like that and urgent care centers. But I'm going to tell you, not a single person in the EMS community is going to take someone there. They're going to take them to that level 2 trauma center. And having the depth of coverage that having the residents there. And not only that, right now today on Capitol Hill, there is nurses speaking out for the patient safety and staffing issues. It's across the country, and that's a known, and that's because of COVID. I'm going to tell you that our nurses here that work alongside of these doctors are learning with them. They're becoming experts with them because they train with them. Myself, I've come in and on their own time and on their own dime have learned from them. Not because they were paid to be there, but because they had the moral compassion and the ethics to know that that's what needs to be done. I'm terrified what happens if this program goes away. I just, within the last month, had a loved one in a rural center having the worst day of his life. And I called out, not because I was do any favors, because I never would ask that, but I'm like, what do I do? And this hospital and those guys in that ER said, we're waiting for him. Get him here. Thank you for your time, and I really appreciate your air.
Thank you. Dr. Chris Southerly? You weren't?
I didn't sign up to speak.
Oh, I got a list turned in, so thank you. Oh, not on the bottom part? Okay, thank you. Dr. J.D. Cameron? No, not speaking either? Carl. This is J.D. Cameron. No? Okay, if Carl's here and Carl wants to speak, that's good. I've got J.D., whoever that is.
Judge, thank you very much. Hey, let me introduce myself. My name is Dr. Carl Serrao. I live at 220 Indiana Avenue in Corpus Christi. And Judge, Commissioners, thank you for allowing me to speak today in support of us maintaining the emergency medicine residency program. I'm not here to represent the residents per se or necessarily SPAWN. I'm actually here to represent the community. I am a pediatric ICU physician. I work at Driscoll Children's Hospital. I've been here in this, I trained here, found my wife here. I live here for the last 30 years. I'm invested in this community. And I have seen the impact that this residency made when it first came into being in 2007. I've seen the impact on the children in this community. Prior to that, it was not uncommon for me to take care of children who were not adequately stabilized, did not receive timely care, and very often had serious impacts down the road. Today, and just recently, I got a call from one of our ED physicians who was trained at SPAWN. I helped train them. And it was a young girl with a diabetic emergency. And he did all the things right. I didn't have to say a word. When she got to us, she was appropriately managed, stabilized, and was home the next day. That did not happen 16 years ago. I will tell you, the minute that the residency program closes, or even before that, the impacts will be felt by the most vulnerable in our community. That will be the children, the indigent, the underinsured, the pregnant women, and those with mental health disorders. They will be the first ones to feel the impact. It will not be administrators, it will not be the physicians, it will be them. I will also tell you that losing this program will affect our workforce, our ability to have access to care and quality of care. I only have a few more seconds, and I will tell you this. People that train here, stay here. This is an underserved area. Nobody wants to come here. Trying to attract talent is difficult. Losing this program, you will see an exodus of talent. It won't be that we won't attract them. You will actually see a net exodus of talent. So I thank you for doing what we can to try to find solutions to keep this program here, because it is a resource that a small community like this can ill afford to lose, and I will tell you, we'll probably never, ever replace it if we do. Thank you.
Thank you. Dr. Garcia? Ed Garcia? Yes.
Thank you, Judge, and thank you to our commissioners. First of all, time is short, I'm going to be brief. I am so happy to hear that a committee is being formed to look into this problem. I'm not holding anyone at fault. I'm not going to blame Christus this or Christus that or people recording stuff or obviously I even got highly a little bit. This affects me emotionally also. I'm here to give you, Judge and Commissioners, I'm here to give you another little perspective. My name is Dr. Ed Garcia. I live at 1009 Delta Drive. I am so proud to say that I left a thriving internal medicine practice in Austin, Texas, to come here, and I'm one of the old timers. I used to work at the old Memorial Trauma Center, the old Memorial Hospital, years before anyone had even ever even heard of a trauma center, or years before anyone had ever heard about an elite emergency room program. And those were the bad old days. Our the racks would just fill up all the way, and patient waits were 4, 5, 6 hours. I then did some work at the old emergency room at Christus Shoreline, and the waits were just as huge back then. I don't know where anyone got this idea of a 90-minute wait. Waits of 3, 4 hours were not at all unusual. Slowly, I moved my practice into occupational medicine, and I am the head of Industrial Medical Solutions. I've got one of the nicest and most interesting jobs on the medical planet. I take care of chemical workers, refinery workers. I take care of heavy construction workers, mechanics. We help Refinery Row coordinate the medical care of the refinery and chemical and construction workers, and we help guide them through occupational, bureaucratic, that's spelled OSHA, Occupational Safety and Health Administration, and we guide them through medical issues. This emergency room and its high-class physicians are instrumental, but enough of me or enough of them. I'm here to represent the workers of where I work and other places. KOS Ingleside, Chemours DuPont, OxyChem, Valero, Citgo, Flint Hills. And these people need not a little old ER, and again, I'm reading from my notes. They don't need a little old ER that we had before. They need a state-of-the-art, sophisticated, cutting-edge, spirited learning environment where they can get the best medical care. Refinery Road deserves nothing less than that. Thank you.
Thank you. I'd just like to point out, we've had a few other elected officials come through. I know we missed Councilman Mike Plessley was here, Councilman Roland Barrera was here, so it's very important. And we just had Judge Klein walk in back there in the back. So just to let you know how important this is to our community, and how involved these other individuals are, and want to be here and hear your concerns as well. So thank you, Judge, for joining us as well. Next up, let's have Dr. Simmons, Michael Simmons.
I'm not a recent graduate of this residency program. My name is Michael Simmons. I'm the EMS director for the residency and city. I wanted to direct Commissioner Gonzalez. I've been here for 24 years now and had a wonderful career with SPAWN. Between Dr. Herrick and I, from the old Memorial days, I have seen thousands of NCHD patients and know several of them by their first names. Really what I want to do is just tell a short story that shows you how much things have changed. In 2006, the Vice President of the United States shot somebody in the face. They were transported to Memorial Hospital. At that time, and I have never spoken of this publicly, so at that time there was one doctor and 2 nurses to take care of that trauma. The trauma surgeon was already in the operating room with another trauma patient. So this fell on that one doctor and the 2 nurses. And that was for somebody that was very important and very well respected. If that happened to the lowliest of us that live in Nueces County now, there would be at least 4 doctors, at least 5 nurses, 2 techs, and a respiratory therapist that will be on there. And that is for somebody that a lot of people don't think matter. That's how much we've changed with the residency program. Thank you.
Thank you.
I guess I could respond, but I'm not going to.
Thank you. Dr. Kim Lisson. No?
If we were all going to present.
Oh, okay. Well, I will go then just to this other list. Thank you. Carl Cavella?
Good afternoon. My name is Carl Kivela, and this is one of my daughters, Eiley, and I live at 1 Camden Place. I'm the captain of the Southern Responder, a 210-foot oil spill response vessel stationed here in Corpus Christi Bay. A month ago, on Wednesday, September 13th, I died underway at the helm of my vessel. Following 18 minutes of CPR and being shocked by our AED, I regained pulse, breath, and consciousness. I was transported first by Port Police boat and then by EMS from Ingleside, and I insisted over and over to everybody that I be taken to Spawn Shoreline Emergency Room. I did this because my wife, an emergency room nurse for 16 years, who worked at Memorial and then Shoreline for a total of 10 years, knows that the best doctors in this city are the ones trained in Spawn's emergency medicine residency program and the faculty physicians training them. And sure enough, I was treated at Shoreline's emergency room by faculty attending Kim Leeson and emergency resident physicians Megan Cook and Dr. Val Knutson. They identified the widowmaker heart attack I was having and sent me to the cath lab in minutes. 4 hours after collapsing at the helm, I was recovering in the ICU and cracking jokes with my family because I received the very best emergency care available in Corpus Christi. Because of them, my wife is not a widow, my children have their father, and I can continue to raise my children and respond to spills and other emergencies in Corpus Christi Bay and beyond. But now, Spawn has decided to prioritize money over providing excellent emergency services, above providing a steady stream of excellent emergency room physicians who choose to remain in Corpus Christi and serve our community, and above continuing to attract and retain the best faculty possible to not only train those ER docs, but also to provide world-class medical care around the clock. This means they want to get rid of Dr. Kim Leeson, Dr. Megan Cook, and Dr. Val Knutson in hopes that they can what? Save a buck? Make more money in other ways? And so I ask you to apply pressure to Spawn executives to reconsider what will undoubtedly be a disastrous decision for our city. I beg you to take a strong stand for health, safety, and well-being of every Corpus Christian and against the closure of Spawn's emergency medicine residency program. Thank you for your time and attention. And thank you to all the doctors and nurses, techs, and others who had a hand in me being alive today to address you. Thank you.
Thank you. That is the end of this list then, if I'm not supposed to go to the other page. Is there anyone here who wishes to speak that didn't have the opportunity to sign up on public speaking? Yes, ma'am. If you'd just come and state your name and address for us, please.
Good afternoon. My name is Christy Snodgrass. I'm at 1014 Texas Avenue. I've been a nurse for 10 years. Most of those years were spent working at Christus Spawn as a bedside nurse and as a case manager. The doctors, nurses, and other staff at Christus were absolutely phenomenal and exhibited a level of expertise that rivaled much larger systems in much larger cities. To say that these healthcare workers provide immense value to our community is an understatement. However, while working as a nurse at Christus, I began to realize that there was a pretty large disconnect between those making the decision for the hospital and those who actually had to implement those decisions and provide patient care. There were constant concerns about staffing, patient safety, and unmanageable workloads. When those concerns were brought to administration, they were often dismissed or promises would be made but never delivered on. That's why it is unfathomable to me that they would eliminate a program that would make those issues worse. Because of these issues, 2 years ago, I made the heartbreaking decision to leave nursing. A career that I loved so deeply, but could no longer do because of the lack of support and the risk to my patients and to my license. Now I work full-time in the world of healthcare reform. I advocate for the rights of healthcare workers and for patients. I was about to board a flight to Washington, D.C. when I heard the news that Spawn was closing its EM residency program. I knew this decision could have devastating consequences on our community. I immediately reached out to some Spawn staff members who stated they could not speak to me about their concerns because they feared Spawn would retaliate against them. Well, Spawn may have been effective in silencing the voices of their staff, but in doing so, they actually amplified their staff's concerns, because if the residents cannot use their voice, then I will use mine. This week, I traveled with a team of healthcare workers to meet with over 50 Congress members. We also met with the Assistant to the President for Public Health and Disparities at the White House and the Department of Health and Human Services. We brought the voices of these physicians and their concerns to the individuals in charge of making decisions for this country. And I asked them to do the exact same thing that I am going to ask all of you to do today. Listen to your healthcare workers. They are the content experts on what it takes to keep our community safe and cared for. They need to be included in all decisions that affect patient care, and their concerns need to be addressed with utmost importance. You have heard from these doctors how this will impact our community, and I'm not going to reiterate those concerns that you've already heard. Instead, I'm simply asking that you give careful consideration to all the concerns that have been brought to you today. The decision Spawn makes going forward will be a reflection of how much they value the voices in the room today. Please make sure that the decision you make is truly what is best for our community. Thank you.
Thank you. And it looks like I missed one. Rachel Southerly, are you still here? Sorry.
My name is Rachel Southerly. I live at 312 Pierman Place. And I am the wife of Dr. Christopher Southerly, who is the medical director at Spawn Shoreline Hospital. Again, I thought I had something prepared, but a lot of people have already talked about it. I want to reiterate, he was not involved in any of these decisions, and it blindsided him, it blindsided me. We are not from Texas. I never would have chosen to live in Texas. It's really hot. We love it here. Whenever my family asks, my friends ask, why Corpus Christi? And we say, we love our jobs. We were at dinner when we got the phone call, and we had just told friends how much we love our jobs. And in a blink of an eye, the rug's getting pulled out from underneath of us. I'm going to brag for a moment. My husband has worked incredibly hard with his core faculty, with the emergency medicine residents, to decrease wait times even more, door-to-doctor times, relationships between the emergency department and the rest of the specialties in the hospital. He stays on top of scheduling to ensure that staff is utilized really well. He's an excellent mentor to the resident physicians. He was even recognized nationally by his contract group as Medical Director of the Year. He's doing an excellent job. And I might be a little bit biased, but I'm pretty sure you could ask most of the people here and they would support that fact. And that's why it's so mind-boggling when it says on the Christus Health website that one of their core values is excellence, that they didn't have him in the room asking him, hey, how can we make this better? I'm proud to know all of these people. I hope that this doesn't take a dramatic turn in a very sad direction, because the emergency department is right now the definition of excellence. And I fear that these decisions that were made seemingly in haste without consulting some of the excellent team members they had at their disposal, it would be going in the wrong direction. Thank you for your time.
Thank you. That's the end of my list. I'm not sure if any of the other commissioners want to speak again. I'd just like to, or were you wanting to speak, please?
Hello, I'm Ruben Pedraza. I'm a physician here, a hospitalist. I live at 7922 Pablo Real. I'm here on a personal level to, Dominic Dominguez described his ties to the community. I also am local. I was born and raised here, went to high school in Callan, went to university at A&M Corpus Christi, went to A&M College Station, and ended up returning here. Like was commented before, I did not intend to stay here, but I found something special about this program, and I ended up returning to train here, and I have stayed here. So it is true. Physicians that do train here will tend to stay here. So I've worked side by side with the residents. As a resident myself, I'm FP trained, but I will tell you, working side by side with them, they are phenomenal. I am also here to speak on behalf of the Nueces County Medical Society. I was privileged to be chosen as the president of the society this past year. So in that capacity, we did call an emergency meeting last night. We did have both sides at the table to explain things to us. It was pretty clear to us that SPAWN does have their their intents, and reasoning behind things. Our stance on the matter is that we have a critical shortage of healthcare in the area. While we appreciate their vision of bolstering primary care in the community, which is an absolute necessity, that is going to take time. And for now, the indigent population in this community is deeply dependent on the ER and their resources. These guys are rock stars, and they deal with these patients day in and day out. And it is our position that we are going to be losing a valuable resource. A residency in a community like ours is a privilege and a gift, and it is a gift that we are going to be throwing away. So they have the backing, full backing of the Medical Society. We are 743 physician members strong. 445 of those members are active practicing physicians in this community, in Nueces County. So that's all I have to say. Thank you.
Thank you. Thank you very much. Rachel Caballero, I'm sorry. I thought you left, so yes.
I am not a doctor. Rachel Caballero, 522 Hancock. I am a community advocate. Full disclosure, I've been a community advocate for about 3 years. I got involved in politics whenever we had a tyrannical judge in office, and measures were issued out to the public by this court. I'm here because I heard the testimonies of these doctors on Tuesday at City Council, and because I want to continue my efforts to advocate for my community. What I can't seem to wrap my head around is that we have been nationally known for a very long time that we have the most obese and unhealthy community in the country. And I believe that Christus Spohn should, if they're doing their research, should know that. As they should know that it takes 18 doctors to fulfill their time, their residency, instead of 12, which their time would not count. Anyway, I have to stay healthy because I'm the sole employee of my small business. But my family, we were not taught how to be healthy or how to live a healthy lifestyle. So my family relies on doctors, and I believe most of you guys have said, Mr. Chesney, you're rubbing your back, so you need these guys too. And so I just don't understand the decisions that are being made to in this program. So a couple of issues. One is I don't understand why Christus Spohn would put a gag order on these doctors, because it is our constitutional right to speak what we need to speak to defend ourselves. And I don't understand why they would defund a program in one of the most obese and unhealthy cities in the country. So I would like to donate my time to be a community representative for that committee. And I've been involved in politics, like I said, doing research for the last 3 years. I know the different politicians that are involved on the boards. So they may seem as friends because they're on the boards, but they're also politicians. And I'm a true community advocate. And so I would like to be able to offer myself to the committee to provide my research and regarding the politics in the area. So thank you for your time, and doctors, thank you, and I'm sorry you're being treated poorly. This is politics, and hopefully the community will wake up and go to bat for you guys.
Thank you. We have Carlos Vargas online. If you can unmute, you're on. Thank you.
Guys, Carlos Vargas here. I'm currently at the University of Iowa undergoing electrophysiology training. Dr. Kim and Ben Leeson, when I was at Texas A&M Corpus Christi, they had the AMRAP program, and that was instrumental in me, wanting to go into medicine, and having the residents there and talking with them really encouraged me to pursue my training. I want to go back to Corpus Christi. I have a house there, 5917 O'Toole. But one of the main reasons I would want to go back is because of the teaching that goes on there and the training. And at my level of training, there's not a single full-time electrophysiologist in Corpus Christi right now. Everyone flies in. So for me to hear that a program is going to get defunded was really heartbreaking to me. And I love teaching, and that's what encourages me to go back. So before this, gets official, I think, they should look at what the salaries are for the CEO and all these other administrators before they cut funding to a really valuable program for the area.
Thank you. I think we've made it clear that we want to provide a working group to discuss this and see what we can do in the future with this. We have, eight members, 2, 4, 6, 8, 9 that I've talked to and selected. I appreciate your input in this. Let me also be clear, I am not going to give anyone any false hope. I'm not sure what kind of authority we would have over this, but we want to listen to you, and we want to hear your concerns, and we appreciate each and every one of you. This is our community as well. When we go to the hospitals, we want to be cared for. So we hear both sides, but we also are great partners with SPAWN and the work that they have done in the past with our indigent care and everything else. We want to keep those communities, we want to keep those partnerships alive. So we want this to be a working group and not an attack group. So if the physicians will get with me and give me the list of the 2 names that they would like to be on there, I believe we can get in contact with you and get this working group started just as soon as possible. I know Mr. Dominguez left, but I feel certain that they're going to be on board with this as well. I think it's just been a rough day for everybody. Once things calm down, we all have the same common goal. We want the best for this community. I think that we can be unanimous in that and moving forward with this group. So unless, Commissioner
Just real quick,
Chesney.
Judge, I just want to kind of end, and anybody else wants to jump in too. Obviously, to me, this is, I really appreciate you taking your time and being here. I'm a little concerned that you're all here and we're not being, we've got all those people that are in the emergency room, so I want to get you out of here really quick. But I really do believe this is a bad decision. I think it hurts indigent people the most, quite honestly. The people in our community that need you the most are the people that have the least, and people that a lot of the people that I represent have the most, and so they can figure this out. They can find it. They can go find it. But the people that that need this the most are the ones with the least, and I think we've got to remember that. And I think it just doesn't make sense to me. But it does hurt everyone. Again, it's not just those with the least, because it hurts the aging community that we have as well to not have the emergency care. So I've heard people say somewhere, this isn't my fight, this isn't our fight. It's everybody's fight. This is every elected official's fight. This is every community leader's fight. This is everybody's fight, because if we don't stand up for this, then we're going to lose this, and it will never be replaced. And I'm sorry, I do not believe one word that people says, we're going to bring more, we're going to bring better, until there's some written agreement and written plan. That's not believable to me. This is real. People can touch this, see this, and feel this. And believe me, I do, and I think the majority of this court does. And we're going to put this together very quickly, because I hear you on this time crunch we're under. And so we're gonna meet early next week, and we're gonna get this going. But the judge said it right. we have a bully pulpit, and we have a relationship with the hospital district that's been very important, and we have a lot of input there because we appoint those board members, but they're an independent board and they do what they want to do. And we have a partnership with SPAWN through the hospital district. So it is our fight. It is absolutely our fight more than any other elected body in this county, but it's everybody's fight. So please don't just weigh in with us. Weigh in with every elected official and tell them to weigh in. Weigh in with go back and this is because I'm going to do it, go back and find all the big donors to SPAWN and call them and tell them, hey, we need you to weigh in, because that money talks, everything talks. We have to do this, and we have to do it quickly, and we know it. And so I feel very good about if we get SPAWN to the table, that maybe we can come up with something. But again, don't leave here with false hope. Leave here with a little bit, but don't leave here with false hope. But I support this 100%. I know others on this court do too, and we appreciate greatly your time and being here, and thank you for presenting this. And we really wanted to give you all an opportunity to be able to have some dialogue. I know it was frustrating at the council because it was public comment, and they can't talk back to you during public comment. So that's why we wanted to set this today, so we could engage with you. So thank you all very much. And if you see me come through, please get me in quicker. I would appreciate it. No, I'm kidding.
Well, there'll be something to it.
I know, no kidding.
Do you want to speak or anything? Anybody, any other commissioner want to have?
I just want to echo that, and especially, emergency room, you all deal with seconds, minutes, and hours. I thought, until many of you spoke, we had days, weeks, and months. Time is of the essence. I mean, we got to get this resolved quickly. We got to start talking, how can the community help support this? We're all in this together. So we got to come to a decision pretty quick as what our strategy is, who those partners are that can help with funding, and come to a solution and say, here, I don't know what we can commit to or how much, but this is what our community can invest in. Can you meet us halfway, right? And I'm not saying that to our physicians, I'm saying that to the administration. Can you meet us halfway? That's my commitment to you, is that we need to put our money where our mouth is now, because we cannot miss out on any more potential residents just blacklisting us because of the problems that we're going through right now. So we will get this resolved in days, in minutes and days, rather than weeks and months. I guarantee you that. Thank you.
Thank you all for being here. We have another judge that walked in. If y'all didn't see him, the other Judge Klein came in, so just wanted to give him a shout out. So your elected officials are very concerned and willing to step out of their courts and come down here as well. So please take note of that as well. Do we have any adjournments in memory today or anything? No?
I know, Judge.
And I will accept a motion to adjourn.
I think he had one, Judge.
Oh, you do? I'm sorry. Did you say you had one? I thought you said no.
Oh, I'm sorry. I misheard you. My bad.
I will accept a motion to adjourn.
So moved.
We have a motion and a second. All those in favor say aye.
Aye.
Aye, and it is 5:08, and we are adjourned. Thank you very much.